I really believe that the diet is beneficial. I've seen it year after year after year, child after child after child of families that have implemented. They come back and say, my child's eye contact is better. I couldn't believe his speech. We have people at school that are commenting. Or, my child is no longer having loose stools. It can really be a big deal. I understand it can be difficult. Is it impossible to do? No. You just have to make some choices and make some changes in the way you shop, the way you cook, or the way you prepare food. But ultimately, as some of the videos have shown, and some of the the menus and recipes, we're not talking about food that's exotic or hard to get. The one thing I feel that when parents are asking me that question is ultimately they don't want to do it. If they're asking me, do we have to do it? What they're really saying is we really don't want to do it. Either because we feel like we're going to be sort of taking food away from our child that he really likes, and it's already hard enough, and can we really eliminate this? Or some people have attachment to food, as though comfort food, this food is love, it's meaningful. There's all different types of scenarios and situations that people have wrapped around food. The problem is that when you're talking about biomedical interventions and you're really looking at the foundation of health, diet and food is key. People need to understand that for many of these kids, gluten and casein isn't just a nuisance, it's a toxin. The way their kids socialize, the way their kids can attend to tasks, the way that their kids can focus can be directly influenced by these foods. So in order to really get that sense of, will the diet work, the only way to know if the diet is going to work is to do the diet. You can sort of cheat, but you're basically ultimately cheating yourself, your family, and your child if you can't implement it, at least for a period of time, 100%. It is really at the base level of biomedical intervention. The food that we eat, because we eat it on a daily basis, has a tremendous impact upon our health. And so in not implementing the diet, you've essentially eliminated a major puzzle piece that can work for so many kids. So when people ask me that question, of course, I want people to do the diet. I want them to do it because I've seen it work so many times. Am I going to not work with a family that doesn't do the diet? Of course not. Am I going to kick somebody out of my practice? No. Because, ultimately, it's a choice. I can't make parents do anything. I can't make them do the diet. But what I can honestly say is that when we implement other therapies, whether it's simple vitamin therapies or methyl B12, therapy or anti-yeast treatment, you may not get the full benefit of it if you happen to have a child who has a gluten casein sensitivity and you haven't put them on the diet.